Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth Heart Palpitations Hidden Triggers. And trust me, it's juicier than your cousin's peach cobbler. Your heart skips a beat, pounds in your chest, or flutters unexpectedly. But what if I told you that 90% of heart palpitations aren't dangerous and can often be prevented with simple daily changes? Yep, entirely true. I can't make this stuff up. Now listen. As someone who's been looking at hearts for longer than some of y'all have been driving, let me tell you what's really causing those irregular heartbeats or palpitations. Here's the kicker. Most of the time, it's not heart disease at all. Your heart is perfectly fine, but it's getting mixed signals like a teenager trying to parallel park. The real culprits? Oh boy, where do I start? Caffeine overload is the #1 troublemaker. I'm talking to you, Karen, with your triple-shot venti whatever Sino at 3 p.m. wondering why your heart's doing the cha-cha at bedtime. Then we've got dehydration. Your heart has to work harder when you're running on fumes, literally. Stress hormones are throwing their own little party in your chest. And don't get me started on blood sugar spikes from that donut you thought nobody saw you eat. Your lifestyle choices directly impact your heart rhythm more than you realize. It's like your heart is a really sensitive DJ and everything you put in your body is either smooth jazz or death metal. Choose wisely. Now, let's talk about the stress connection because this one's a doozy. Chronic stress releases cortisol and adrenaline that basically turn your heart's electrical system into a disco light show. Your poor heart doesn't know if it should be waltzing or breakdancing. And here's where it gets really fun. Poor sleep quality amplifies this effect like a loudspeaker at a rock concert. You end up in this vicious cycle where stress causes palpitations, palpitations cause more stress, poor sleep makes everything worse, and before you know it, your heart rhythm has more issues than a soap opera. Managing stress isn't just about feeling zen and drinking chamomile tea, though that's nice too. It's about protecting your heart's natural rhythm from going completely rogue. Let me tell you about Sarah, a 45-year-old teacher who came to see me experiencing daily palpitations for months. This woman was convinced she was having heart attacks every day at 4:30 p.m. We ran every test in the book, EKGs, stress tests, the whole 9 yards. Heart was perfect. So I told her to become a detective of her own life. After tracking her habits for just 1 week, boom! She discovered her 4 p.m. energy drink was the trigger. Every single day, like clockwork, she'd slam down this liquid lightning bolt to get through the rest of her teaching day. Her heart was basically saying, "Lady, what are you trying to do to me?" Within 2 weeks of switching to herbal tea and adding a 10-minute walk instead, her palpitations disappeared completely. Sarah went from thinking she needed a cardiologist to realizing she just needed to break up with her energy drink. Sometimes the solution is simpler than we think. So what's the prevention strategy? First, maintain steady blood sugar with balanced meals every 3-4 hours. Think of your blood sugar like a roller coaster. The more loops and drops, the more your heart wants to jump off the ride. Keep it steady, people. Stay hydrated with water, not just caffeinated beverages. I know, water is boring compared to your fancy drinks, but your heart loves boring. Boring is beautiful when it comes to hydration. Create a consistent sleep schedule to regulate your body's natural rhythms. Your heart needs to know what time zone it's living in. If you're going to bed at midnight on Monday and 2 a.m. on Tuesday, your heart's more confused than a tourist in Times Square. Here's my actionable takeaway for you, and this is gold. Starting today, keep a simple heart diary. Note when palpitations occur and what you consumed or felt in the hour before. Write it down. Was it after your third cup of coffee? After that stressful phone call with your mother-in-law? After skipping lunch and eating a candy bar at 3 p.m.? This one habit will reveal your personal triggers within a week. I guarantee it. And if you're having palpitations daily and can't figure out the pattern, maybe I should see you in the clinic. We need to talk. Remember, knowledge is power, but applied knowledge is what changes your life. Your heart is talking to you every single day. It's time to start listening to what it's really saying. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy. And remember, if you're looking for answers, check out drjeffreytauth.us.com later, y'all.